Corona, COVID-19. Those are words that have now become common worldwide, causing frustrations, fears, anxiety, increased stress, mood disorders, depression, and overall increased cases of mental health. We have become limited in our day-to-day lives, losing jobs, paying bills, healthcare systems struggling, losing homes, children learning from home, social distancing, social isolation from families and friends, and this has become a great impact that COVID-19 has on mental health.
COVID-19 has brought about social isolation, and having people who are actually, human beings are naturally social animals, and so when we are confined in spaces, over time it tends to affect our mental health. One of the things we have seen apart from anxiety is gender-based violence is on the rise, and this is affecting the mental health of many women especially. So from our helpline, we've seen a steep rise in call rates. We are seeing over 150% increase. That's even before we've done heavy campaigns to share the helpline to people.
Warimi Karingi, who is battling depression, tells us how the pandemic is affecting her mental health.
Unfortunately for me, my anxiety started even way before Kenya started reporting any cases. So by the time Mutai Kagwe started reporting cases, now I got even worse. So what happened is, as I mentioned earlier, I suffer from depression and anxiety disorder. So my anxiety really spiked, and my depression now, I went into a relapse. So meaning that I couldn't eat, I couldn't sleep, I was constantly crying. I also was having a very severe negative thoughts. And when I say negative thoughts, I'm even talking about even almost getting suicidal.
As the founder of Let's Go Mental Kenya, she advises people, especially those dealing with mental health conditions, on how to cope during this period.
Try and minimize on your social media and watching local news and international news. That is one thing that will keep your mind a bit clearer. Based on the fact that there's this social distancing or physical isolation, try and, so for example, if you can do video calls with your loved ones, with your family and your friends, because I've noticed you tend to get a feeling of it's one-on-one interaction more than phone calls. So I would say maybe do video calls. Third thing is exercise. You need to find a way to exercise because exercising clears the mind. Exercising gives you feel-good hormones. It releases endorphins. So exercising is very good. So you can have, like, if you go on YouTube, there are very many YouTube workout channels, workout videos. And you can also just take a walk in the evening or in the morning, whenever you feel that you can do that. And then, of course, also connecting with your maker.
However, during this pandemic, organizations, health workers have stepped up to help people deal with anxieties and mental health conditions. Bride Shitemi, the CEO of Mental 360, tells us more.
Call that number and get psychological first aid. You can also get linked to mental health professionals to do one-on-one sessions, either on phone, through calls, on video, through Zoom or Google Hangouts, and any other online platforms that you may deem necessary.
In Kenya, 1 out of 4 people are likely to suffer from a mental disorder at some point in their lives. Yet 5 in 6 Kenyans with mental health did not receive treatment, meaning that these trying times, Kenya could see a spike in the rise of mental health conditions, putting the government, organizations, health workers at a tough spot to ensure that mental health care is a priority. Even as the world is at standstill with the country adjusting to the no county to county movement, people are isolated from their homes and from their friends and families. It is, however, crucial to remember there is no health without mental health. Harriet Chimea, Switch TV, Nairobi.